Hi, my name's Mary Wade, and I'm going to talk about the strategy for chronic disease management in a geographic area, targeting the public health in the U.S. comparison to other countries. Strategy in chronic disease management. The roadmap plan is step 1 to link the impact of chronic disease as on the healthcare system. Step 2 is to create a geographic origin area of equity. Step 3 is diagnose chronic disease issue. Step 4 is to design a plan to implement the weighing out pros and cons. Step 5, secure who the stakeholders are, the economy's healthcare investment in chronic disease. And Step 6, implement the chronic disease change. So an overview is the impact of chronic diseases have on healthcare system and the global issue affecting our economy and our community. Plans to improve the care. Early detection means early treatment. The stakeholders and their impact they have on chronic disease management. Timeline for change. The economy investments and what are the benefits, pros and cons. Also, the chronic diseases with infections and morbidity diseases are a fast-growing epidemic health problem in the U.S. Reason for choosing topic. Chronic diseases are a fast-growing epidemic and global issue. The serious impact it has on healthcare system, the economy, and the community. It costs billions a year that we're losing. The threat of chronic diseases among infectious diseases and morbidities and the hazard it has to the environment. Chronic diseases cause premature death and an effectiveness on the quality of life. To involve healthcare organization systems of individual persons, families, and communities. The healthcare system is also impacted by long-term prognosis and progression of these diseases among the productivity that is lost in the physical and mental function. Plan to implement the initiative. First, we want to improve chronic disease care, promote early detection and early intervention, develop partnerships in healthcare systems of organizations, patient participation, and compliance. To strengthen the healthcare prevention, we promote building health partnerships. We find the determinants and identify risk factors and prevent. The focus is to reduce the burden of chronic diseases and develop a need and change in each level of the health system. Chronic diseases can be prevented, detected, and self-managed. Research shows in Waterloo, Wellington, in 2005 that 70% have at least one chronic condition. 35% of the 70 included high blood pressure, stroke, heart disease, cancer, diabetes. And over 2/3 of the population in the age group of 45 and older, they have multiple of these conditions. The hospital costs can be avoided by millions with the proper healthcare management. And in Australia, chronic and non-communicable diseases accounted for 70% of people's illness or injury. Identify who the stakeholders are and why. Stakeholders are national and international organizations with goals to prevent and plan for future health and promotion of diagnosing and prognosis of chronic diseases, healthcare to make an impact on a better quality of life. These organizations or programs are WHO, which is World Health Organization, the CDC, Public Health Leadership, National Heart Association, Cancer Association, Diabetes, National Tobacco and Alcohol Strategy, and Health Aging Program. A timeline for implementation. Timeline year basis for 2010 to 2020 is to identify the risks in epidemic and chronic diseases for 10 years of collection from database surveys that are based upon the population status and their behavior. To increase the health rates of 20 to 30% from these chronic infection and morbidity diseases. The population pyramid is based on intensity services from level 4 to level 1. It's basically working with these patients to help them learn and practice a better way of healthy living in and out of the hospital. And Water 2 Wellington, for chronic disease prevention and management framework, they developed a stratification pyramid level based upon the population-based needs and services. So level 4 is at the very top. It's intensive case management. Level 3 is case management. Level 2 is self-managed support, and level 1 is health promotion. So their goal is to go from level 4 and get the patients better and get them down to a level 1 base. Return investment. Healthcare costs are at a high, and due to this, the productivity is lost. So more than 50% of healthcare costs are caused by these chronic diseases nationwide. National research from each country shows billions lost per year. Stated in the Canadian Academy in Health Science article 2010, it says the burden of chronic diseases are growing, and the people are suffering from these conditions. The healthcare system and the providers are stretched beyond their capacity. So with these rates continue to grow, more than 80% are going to make up the total program spending in the amount of healthcare expenditures by 2030. So basically, the percentage of these chronic diseases in the population nationally and internationally are increasing instead of decreasing, and millions are used in the healthcare budgets. The pros and cons of strategy. The pros of chronic diseases are preventable. Longer quality of life is measured. The healthcare community's self-management and skills can be developed through information, proactive, and being prepared. Being more aware by proper management can save millions in healthcare annually. And the development of partnerships can manage the risks and become self-teachable on prevention of chronic diseases with levels of care and performance levels. The cons are improper care and intervention. The economy will increase the cost, and the quality of life will continue to decrease. These cons are also the factors of chronic diseases. It's because of the income levels, employment, the social support, if it's hereditary, the environment, the education. They all reflect the patient's system of consumed by these chronic infections and morbidity diseases. So take the initiative and to implement change in chronic disease management in our healthcare system. So in conclusion, to improving the quality of life and self-management and in chronic disease, development of national and international strategies will build an importance on health promotion by giving life perspective with the benefits in life prevention and health prevention, which are the key components of taking action against chronic diseases to ensure the effectiveness of health information and strengthen the improvement of quality in the healthcare system. With the development of data collection based on existing evidence activity in the behavior population, the national organizations can lead healthier indicators to assist on establishing prevention programs and resources on how to practice a healthier way of living. In the United States, among other countries such as Australia, China, United Kingdom, and Finland, the self-care partnerships, education, and support are keys to achieving goals and fighting against chronic diseases. So what we've learned is that the key strategies are equity, consistency, prevent, detect, intervention, evidence-based, and collaborate change. And that is it. Thank you. And there's the bibliography.